Hey you guys, how are you? I hope that you're well. It's nice and sunny outside, so make the best of it. It is not very warm though, so ensure that you dress appropriately. Don't be deceived by the lovely sunshine that you see. Okay, I'm stuck indoors today. I'm not going anywhere. I'm gonna go for a little walk later. My son is gonna come and we're gonna go and walk, do a bit of walking as I have to do to follow my surgery. But guys, there's something I just wanted to address or talk to you about regarding stuff that we should be doing or information that's been given to us by our professionals, our surgeons, our physiotherapists post surgery, the do's and the don'ts that we are supposed to be practicing or that is recommended for us for speedy recovery and for our own health. So I was going through TikTok, I think yesterday or earlier, and I saw this post come up with a young lady. It appears as though she's had abdominal surgery, and our fans were, she probably posts about the procedure and or everything that she's done, and our fans were asking her whether she can drive now. So she was videoing herself driving and saying, you know, she can drive, which is hats off to her. Probably, I don't know how far along in her recovery she is, and she's been back at work. So, and I must say, I do not know if she's had abdominal incisional or an abdominal incision, or she's had KO surgery. But this, some of the things that she was saying that she was advised to do, but she was not following it. She was going to do things before the time span that she was given, because she felt that she was fit enough to go back to the gym, so she was going to go back to the gym. She's been driving and all this stuff. Hats off to her, but just remember, her luck is not your luck. And if you're driving and your insurance and anything should happen and you would like to claim on your insurance also, and they know that you've had this procedure and different, your advice that what you should be doing, you should not be driving and that type of stuff, you will not be able to claim anything. You will lose out. So guys, do not follow what people are saying. If you've been given instructions and recommendations by your medical professionals, that those are the person that knows the reason why they're actually saying these things. So just follow that. Everybody is not the same. Yeah, so I wanted to say I just wanted to go through a few things of why is it so important to follow the recommendations and advice given by your doctors, therapists, the entire team post-surgery. So once you've had surgery, the post-operative recovery process can be a long one, yes, but we need to have a smooth and successful recovery process that will minimize complications, promote healing to our tissues and our bodies, and restore us to normal function. Yes, so this, when we've had surgery, it includes or it involves organs and tissues, vital organs and tissues that have been worked with, that has had intervention or they would have been involved in this surgery. So once these organs has been interfered with, or once you've had them adjusted or certain things removed or whatever it was, yes, we need to have a smooth recovery. Recovery is very essential, and you want to prevent infection, you want to prevent bleeding, you want to prevent all these other complications. And trust me, you want to do that, because I was following all the recommendations post surgery, and by the time I was back on day 7 or day 8, I was back in hospital with bleeding from the wound, and I hadn't done any exercises, I hadn't been lifting any, I did nothing but rest and did a bit of walking in the house, and I developed this complication. So this is why I'm saying to you, it is important for you to follow the instructions. So you want to promote healing, and you want to restore your normal functions. So please follow the instructions given to you by doctors, surgeons, that you, first of all, you want to prevent blood clots. So we should be mobilizing, and that is a good thing. Do not mobilize earlier than you've been advised to mobilize. If depend on your complication, depend on the severity of your surgery. If you're not allowed to mobilize more than 24 hours, less than 24 hours, then do not do it. There is a reason for that. So once you can mobilize, that will be so essential, because then you can prevent one of the serious complications post-surgery, which is developing blood clots. And blood clots can lead to death, because they can go and block your heart, block your lungs, and you cannot breathe, and there is nothing they might be able to do to save you. That is a severe complication, but who is to say that it would not happen to you? Because it happens to person, and it has no respect of who will develop a blood clot. So just be mindful of that. And I've came across a lovely, wonderful leaflet produced by the NHS regarding recovery, on the process in recovering from major abdominal surgery. You can find it on Google. If you just click on why is it important to follow instructions for post-surgery, you will see quite a lot, but this leaflet is so very good, and it is detailed. It is produced by physiotherapists, and it gives you all the important information regarding do's and don'ts, such as exercise pre and post procedure. You might need to be doing some exercise pre-procedure, and then you definitely have exercise that you have to do post-procedure. So this leaflet gives you all that. It gives you information regarding walking, sleeping, exercise, so many things that you need to do, and it's important for your recovery after surgery. So it aims that you should be walking at least half an hour a day, maximum half an hour, for like 6 weeks, and then you gradually start improving that. Or you know, depends on how your body feels. So you should just do these, and these instructions are detailed. They're details. They tell you exactly, give you all the instructions of how to get them done. And you should not be doing any moderate exercise until after 3 months. But then you should discuss that with your doctors and your team, because your circumstance might be different to others. That is a general rule, but you discuss it before you go into moderate exercise. So this young lady that was saying to people that she's going to the gym in about her 5th week because her body was feeling well, do not practice that. Do not take the advice, guys. I'm telling you, lifting is a no for anything 2 to 3 kilograms. That's, for example, like lifting a kettle with water. You should not do any lifting of anything of that nature, anything with that weight or more, for up to 6 weeks. It can cause pain, it can cause hernia, it can cause complications. Do not lift anything. If you had a large incisional wound like myself, it can take up to 3 months for you to move around comfortably. But if you had a keyhole surgery, your recovery will be quicker. So speak with your team. They will tell you when you can start doing those things. So as it relates to driving, driving is only recommended if you're comfortable and if you're driving without pain. The main reason they're saying not to drive is because if you were to have, or if you have to practice an emergency stop, it can be very painful and limiting to you to do that because of the pain. And if you can't do that, do not drive. You should practice. If you want to drive, you feel your body is doing great, you should practice emergency stop in a garage area, not in a busy place, in your garage area, so you can see if it's manageable for you. If you're taking painkillers, strong painkillers that can make you dizzy, do not drive, because you can fall asleep at the wheel. It can also impact your judgment. Please do not do these things. So just be mindful when we're looking at these posts and we're seeing people posting all of these their experience and what they're doing post-surgery. Do not take it. As a medical professional myself, I am going to follow the advice because I know what can be the consequences of that. So I just wanted to bring this to you guys, just to let you know that what somebody else can do will not be what you can do. What their experience is post-surgery may not be your experience. Follow the advice, speak to your team, how your body feels, then you go it. If you're feeling pain when you're doing anything, do not do it, because that is telling you that you're putting strain, you're causing injury to yourself. So guys, I am just trying to help you. I'm just trying to do not make the lines blurred about what you can do, what you cannot do. But I would advise you to go. Anybody that has had abdominal surgery, probably you haven't had all this advice and you're not sure why you've been given all these recommendations and advice. That leaflet that I'm telling you about is a very, very good leaflet. You can access it. So if you know anyone that has done an abdominal surgery, if they're going to have one done in the future, or if they've just had one and recovering in hospital, anyone you know, you can be your family member, can be a friend, never know. And if you see them practicing these things, just say to them it is not recommended, or just make them aware of it, because you've been educated, so you can educate others, because we love them and we do not want to see them being incapacitated or developing complication as a result of not following doctor's advice and recommendation. So this is just what I wanted to bring to you today. I hope it is very informative, and I hope that it's an eye-opener and that you will use it. I hope that somebody that needs this information can access it and be able to recover as smoothly and as successfully as you can without any complications. Just remember to subscribe to my channel, whether you're on YouTube or just like and share my page, and follow me for more information. And I am really and truly quite wanting to bring real and positive and very informative information to you. So guys, if you know anybody, pass this video on and share it so we can all be informed. Have a good day, have a good evening wherever you are, whichever neck of the wood is you are. Have an enjoyable rest of the day or evening. God bless you. Thank you.